a history of heart attacks. My first one was in 1996. Had another heart attack in 2000, another one in 2001. Had another heart attack in 2005. That one caused me to have to retire from the Veterans Administration. And then I had another major heart attack in 2011. I was very severe and very close to death after that heart attack. And that was due to congestive heart failure. They were about to part out different parts of my body, and they were asking, was I a donor? My wife asked them to transfer me to the med center because she heard about the Thoratec device, the HeartMate 2. The med center got me back to health after 10 days, got me physically well. And on the 13th of February, I was implanted with the Thoratec 2 LVAD. And at the time, I had no idea what the LVAD was. I had no idea what was going on with me. I just knew that my life was being saved. I was on the LVAD from February the 14th, which is Valentine's Day, till August the 14th. And during that time, my life physically had turned around. I was able to go golfing. I was able to do everything I could have done without the, as a regular person could have done with the HeartMate. It was a device that really saved my life. I was able to breathe. I was able to walk around. It was as if I was given a totally new life. As a matter of fact, when it came time to get a new heart, I was not sure if I wanted to give the HeartMate up. It was quite a decision I had to make when the phone call came. The day before I got my heart, I was on the golf course, and I beat my nephew, who's only 22 years old at golf. And he was so slow that I said I wasn't going to take him out golfing anymore. I was just having the time of my life, and I recommend the HeartMate to anyone. As a matter of fact, that's what I do. The services that I received through the med center and through all the nurses, the doctors, and everyone there, that was some of the best service I've ever had. As a matter of fact, it continues to be very good service. I couldn't highly recommend any other place. That's why I'm so glad that I'm still alive. I'm so glad that I found the med center. I'm so glad that I found the Thoratec 2 HeartMate, and I'm so glad that, hey, that I'm still here. It's not just a slogan. It's for real. It's extraordinary care. From the nurses, even all the way down to the cleaning help. Just walking through the door, you know that there's something different about the medical center. It's extraordinary people. They make a difference.
I've always had heart failure. I had rheumatic fever when I was young. Didn't start really getting bad until I got into my 60s, I think, my 60s, yeah. And I was being tired and all this kind of problems and not able to do a lot. One of the doctors at Creighton, she told me that I should come to see the people at the university hospital because they had a great plan and that I should come over there and see them. And they introduced me to the LVAD and everything and told me and my sons about what was going on because I really didn't understand or know what the LVAD was. And then I just said, well, gee, if something that's going to improve my life, it's something I want to have, it's something I want to do. I've had my LVAD a year and I got it in May 10th of 2012. And it's been one of the best thing that has happened to my life, I can say. Before I got the LVAD, I was always tired. I couldn't walk. say, but maybe a half a block without stopping and taking a breath and not doing any, just standing around. Going outside and far as doing yard work and that, I just couldn't do any of that at all. And now I'm able to go out, move around. I can go to the stores with my sons and shop. And I also am able to my whole life has changed. My whole body feels a lot better since I've had it. Enjoy my family. When I have a lot of company, instead of sitting in a chair, falling asleep or something like that, and not enjoying my whole family, I can get up, move around, and do a lot of things that they do with them. Doctors and the nurses and all the intern people at the university are the best people. Because once Shannon, Tim, and Ann, and Dr. And Dr. Lowe, they come in and explain to me what was happening to me and what was going on. It was a great thing for me. I appreciate all that they've done for me and all that they're still doing for me. This LVAD has improved my life 100%.
When I was 4, I was diagnosed with myocarditis, and they treated that for 11 months. Didn't address the arrhythmia because that wasn't something they did yet. When I was 19 years old, I was diagnosed with cardiomyopathy and ventricular tachycardia, which they treated with pacemakers and medication for approximately 10 years. And then as of February last year, I needed my first LVAD. I had failed the stress test, passed out on the treadmill, woke up in the hospital bed, not feeling well, didn't have circulation, and they told me I needed the heart mate. I didn't know about the LVAD until a day or two before I had it. I got to meet a couple of patients that had the LVAD, and they were both a lot older than me, so I knew that if they could do it, I should be able to do it. The greatest thing for me to see was that there was a woman walking around with a walker in the hospital, and I could not catch up to her to ask her about her LVAD. I went from always being cold to being hot all the time because I had circulation now. The blood was actually pumping. But I did get a second LVAD in May of that year, May 17th of that year. My blood had clotted the pump, and it was shredding the cells, so I wasn't getting any blood through my system because it wasn't circulating it anymore. And they kept me in the hospital for just about a week. And the day that they were going to send me home, I said I didn't feel well and I just didn't want to end up having to come back. So they let me stay one more night. And that night I got the call that they had a heart for me. Pre-LVAD, it took me 5 years to graduate from college. I was told that a trip from one end of campus to the other should take about 10 minutes. My dorm room was in the middle of campus, and it would take me at least 15 minutes to get anywhere. I could go a few steps and then I'd have to stop. I ended up with a handicap pass, parking pass, because it could take 2 hours for me to get from my car to my dorm. And normal living for me was going to class and then coming home and laying down because I needed a nap. I was done. Friends would go out to dinner and a movie, and I could do one or the other, but I just didn't have the energy to do both. And it wasn't until I met the cardiologists at the med center that I was being told, okay, really, you know, people do both. After the LVAD, I had a lot more energy. I felt like I could go on a vacation. I felt like I had the circulation again. I wasn't cold anymore. And I did have more energy than I'd had before that. The big question that they asked me pre-transplant was, why did I deserve a heart? And my answer was that I wasn't done yet. I had stuff to do. I wasn't married, didn't have my own home. I don't have a job yet, and I wasn't done living. I've always had great trust in the med center. My cardiologist there, I have a standing relationship with her of 10 years. And the surgeon, I have the same trust in him. Whatever he said went, because I knew that they were both qualified in their field. I know that they know the most about it that I can find, and I wouldn't go to another hospital now if I needed to.
first heart attack in 1993. Numerous problems throughout the years. Had a double bypass surgery in 99. And basically up in June of 2011 was diagnosed with cardiomyopathy and congestive heart failure, and was told I would need an LVAD, and didn't know a darn thing about it. But since I was still smoking, they said they wouldn't even think about doing anything for at least 6 months. Their other choices were, well, you can have a transplant, you can get the LVAD, or you can basically push up daisies. And I wasn't ready for that one, and like I say, I've got things I still want to do. Prior to having the LVAD put in, I couldn't walk up a flight of stairs without stopping. Getting out of the recliner to go to the bathroom was a chore. Now I can carry stuff up that flight of stairs and don't stop halfway up that flight of stairs. I can keep up with the kids at the elementary school where I volunteer. I don't have to, like, oh, you gotta wait a minute because Mr. John's got to rest for a few minutes. Yeah, so the quality of life is, guys, so much better now. I wouldn't be here today. I mean, so I guess from that quality of life, yeah, if you're not going to be here, that's a big, improvement. I can still go fishing. I can, we love to fish, both Linda and I, and I still do that. I still go down and help her brother work on the old farmhouse. We're gutting it down to bare studs, all new wiring and all new walls, and the care is exceptional. I mean, I don't know how else to put it. I mean, from all the RNs and the techs on the floor, I had one young tech. I had found a place in the recliner after my surgery that I had basically zero pain, which after surgery is a great thing to have. And I thought, well, if I could figure out the angle of this chair and transfer it to the bed, it'd be great for sleeping purposes. So she went and found cardboard and all these straight edges, and Linda and her drew all these angles off of the chair, transferred the template they made over to the bed, adjusted, marked it on the little side of the bed so that I could set the same angle on the bed. Way above and beyond what her job description calls for to do. And when I left the hospital, and she had told me she was in nursing school and she was going to graduate in the spring, and I said, even when you're a nurse, just these little things like that you did make a huge difference for the patient.
I felt like I had the flu, and I went to see my family doctor a couple times, and because I was having trouble breathing, getting enough oxygen, I was always tired. My infraction output was only 10%. So basically I was on my way out. My daughter had a liver transplant in January, and the stress of the problems that she had, my heart started failing again. With a bad heart already, it was just more than I could take. I was gray, no circulation, no oxygen. I couldn't hardly walk. Once I had the LVAD put in, I was able to get up out of bed, with some help, and I would walk around the halls at the hospital because I wanted to get out and go home. If I wouldn't have done the LVAD, I would not have survived the year. And, there's a choice here, yes or no, and I said, yes, I'll take it. That was part of my healing process, was knowing that I was at a good place. Every once in a while, there'll be people that are there that just have had an LVAD put in, and they're scared. They don't know what's going to happen. Well, nobody knows what's going to happen exactly, but we try to share what we went through with them. Overall, the hospital has been phenomenal. All the nurses got together and, did their thing. They sang happy birthday to me, and they brought me cards and stuff. And that's why I say, you're not in this alone. You have great support. I got the heart June 26th, and it was the best day of my life. I'm one of the luckiest guys
because I was knocking on the door and I didn't go through. And for that LVAD was what kept me alive long enough to get that heart.